Hello everyone, happy evening, a very good evening. I hope and I believe all of you are doing well. Quick note everyone, am I audible and visible everyone? All right, that's great. So I hope and I believe all of you are doing well, guys. Right? Both personally, professionally, and in every field. I hope you remember the four pillars that I always, and not just into studies, and into the stress, the exam, right? So here we are. Fast episode. What is fast is first aid simplified teaching, right? Very commonly requested topic, that is the lymphatic drainage of the various organs, particularly the abdominal and the pelvic organs, because this helps you in understanding the malignancies as well, the metastasis, right? So this has application. This is core anatomy, but this definitely has application into your oncology as well. Which malignancy, which cancer will metastasize to which lymph nodes. uh, Audio is breaking. Is it true for everyone? No, right? Okay, so that message is gone. Let me just check. Is the audio any better now? Is it any better now, guys? Okay. Hi, good evening, everyone. I see my very dear students who are there in the in-app live classes as well on the Medsynapse app. So happy to see you all here. And apart from this, after this session, you have a homework to be done. And that's a homework which can be done by everybody, whether you are there as a subscriber of Medsynapse app or no. So what is that homework is? So we have made the mini GT5, which is live. Okay, the mini GT5 is now live in the Medsynapse app. So this has been made free for all for a limited time. So please, given the test, right, and it has a video discussion. So the mini GT has 40 questions, right? And every question has a trick that you would learn out of it, whether it's a mnemonic or it's a MCQ solving skill, how you rule out the options, all of that, right? So this is going to be extremely useful. It is based on the topics that are very frequently asked. So all the students, whether you are appearing for FMGE or NEET PG or INICT or the RUHS students, all of you, please give this test. How do you access this test? Let me quickly tell you that as well. So you go to the short course, which is there in the app. There on the top, you would see this content tab, which is going to be there in the app. In the content tab, you are going to see the mini GT, right? There is this test discussion folder. In the test discussion, there is mini GT discussion folder, which is there, and you would have the mini GT5 there. So there's a video, right? And then attached to the video, you have the PDF also, and you have the attempt test option, which is there. So do not watch the video before giving the test. First give the test. It's 40 questions. You have 42 minutes, but I would recommend try to finish it in 30 minutes itself, right? So 30 minutes for giving the test, and the video discussion is approximately of 50 minutes. So you can watch it at a faster speed and finish it off in the next 30-35 minutes or so, right? So give dedicated 1 hour, give the test and watch the discussion immediately, and write down all the tricks and the mnemonics that you learn out of that video and the test. Okay, so this is available to everyone, guys. Please give this test. Very important. Okay, yeah, this was a sudden surprise class, but a very important one, right? So let's dive into the topic here, guys. So if you ask me, this is USMLE first aid, the 2024 wala edition. You will find this on page 95. Otherwise, I've shared the PDF on the Telegram group as well, the blank PDF. right? So annotated PDF will also be uploaded, right? So you can access the annotated PDF from the Telegram group or even from the Medsynapse app, where you have the fast folder which is there. Okay, we upload these fast videos in the Medsynapse app in the fast folder as well. Okay, the last fast episode that we have, which was a YouTube live, that was on the neurotransmitter changes in various diseases. We had simplified it, right, made it very easy to remember what happens in Alzheimer's, Parkinson's, right, psychosis, all of that. I hope you remember that. Try to make one-page notes out of this one topic that we are discussing, so that it's easy for you to revise at the end. Okay, so that's your target. Yes, Arman, Belim, absolutely. Like I said, FMG students must also give this test, not should or not might. It is must give that test, because it's a very easy test based on the basic topics. So it's going to be like a good assessment test for you to assess that how good you are with the basic topics, the core topics that are asked in the exam. So that mini GT5 should be given, must be given by everybody. Okay, that's should be given by everybody. So this is the page, this is the table that we are going to talk about, the lymphatic drainage, right? And quickly at the end, we will also discuss in details the lymphatic drainage of the tongue. Again, something which has been discussed in detail in the short anatomy video. The Medsynapse app subscribers know that, right? We'll quickly discuss about that as well. So the first thing that you should note in this figure is, okay, visual memory is actually the best memory to help you remember the stuff. So remember this image, and you can see that this part of the body, this is being shown in a different color as compared to the rest part of the body. So let's say if I'm dividing the body into 4 quadrants, okay, right upper, right lower and left lower. It is this right upper which is shaded in a different color. Okay, the right upper is shaded in a different color. Why is it shaded in a different color, guys? Why is this right upper shaded in a different color? Because it is showing that this lymphatic drainage is different from the rest of the body. Okay, so your left upper and the entire lower half, this is drained by, which is the major lymphatic channel in our body? The major lymphatic channel in our body, that's the thoracic duct, right? The thoracic duct. So this is written here as well, that thoracic duct drains below the diaphragm, right? The left thorax, upper limb, where does the thoracic duct drain? This is a question in itself, right? So if you remember, thoracic duct has also been discussed in the app. So thoracic duct drains onto the left side, right? At the junction of which two veins? The IJV and the subclavian vein, right? The left IJV and the left subclavian vein. Left IJV draining the head and neck area here, subclavian draining the upper limb here. So at the junction of that is where the thoracic duct is draining. So it is going on to the left side. So remember, it is draining this left half, left upper, and the entire below diaphragm part of the body, right? Everything below the diaphragm and the left half, it is being drained by the thoracic duct at this junction. Another important question that is frequently asked. So when there is rupture of the thoracic duct, it will lead to what in the pleural fluid if thoracic duct is carrying the lymph? So when the thoracic duct is rupturing, there will be lymph, right? The pleural effusion which is there, basically it will contain the lymph. And what is that called as? That is called as chylothorax. So rupture of thoracic duct will cause chylothorax. Remember, this USMLE first aid book is such that you never know from which line what question will be framed, right? So only when you read it with utmost attention, you would realize that every question, every line has a potential question. Okay, is this clear with everyone? Right? So this is very important to remember. This is your first question here. Right upper half of the body is not drained by the thoracic duct. Second, thoracic duct drains into the junction of the IJV and the subclavian on the left side. Third, rupture of thoracic duct will cause chylothorax. Okay, so these are the 3 potential questions that we have discussed here. So you have something called as right lymphatic duct, which is draining the right upper half of the body, where same thing, the junction of the right subclavian and the internal jugular vein, you have the right lymphatic duct. Okay, so this is the first part. Now we'll go on to the next part, and we are going to discuss about the lymph nodes one by one. So first we have put the lymph nodes above the diaphragm, ek page pe, and the lymph nodes below the diaphragm, another page, right? So the first half of the table, very easy. submental and submandibular lymph nodes. Logically thinking, these are placed here. So what will drain? The oral cavity, the anterior tongue and the lip is going to drain into these lymph nodes, right? So it will have malignancy, metastasis from the oral cavity, right? Submental and submandibular lymph nodes. Then you have the deep cervical lymph nodes. We are going a bit down, right? So it is head, neck and oropharynx area. Right, so this is where you have the upper respiratory tract, infectious mononucleosis, important, remember, Kawasaki disease, a very common vasculitis in children. Kawasaki disease generally has what manifestations they give you in the question? There is cervical lymph nodes, plus what do they give you in the question? Cervical lymph nodes, right? What else is there? It is mucocutaneous lymphadenopathy, which is there. Muco is the mucosa, the tongue. There is strawberry tongue. Cutaneous, right? It can have the rash on the palms, right? So there is rash, there is strawberry tongue, plus the cervical lymph nodes. All this is given in Kawasaki, right? Remember a recent exam question, conjunctivitis is non-purulent conjunctivitis. And malignancy of head, neck and oropharynx. Then you have supraclavicular lymph node, the right supraclavicular and the left supraclavicular lymph node. Important. Which of these is called as Furcow's lymph node? The left supraclavicular lymph node is called as the Furcow lymph nodes. Because what is going here? The left hemithorax, abdomen and pelvis. You know, right, how the thoracic duct coming from here below the diaphragm and going on to the left side. So everything here below the diaphragm, the abdomen, the pelvis and the left hemithorax. That is what is going here. So remember, the left supraclavicular lymph node will come here. The right hemithorax will go into the right supraclavicular lymph node, right? Is this clear with everyone? So remember that supraclavicular lymph node can be involved in the abdominal or pelvic malignancy, but which supraclavicular lymph node? The left supraclavicular lymph node, and that is what is called as Furcow lymph node. Okay, that is what is called as Furcow lymph node. Clear with everyone? Right? Going to the next one, right? You know that supraclavicular lymph node also comes in CA breast, right? In CA breast, what is the sentinel lymph node, the first lymph node to be involved? What is the sentinel lymph node? Sentinel lymph node is the axillary lymph node, right, which is the most important prognostic factor in a patient of breast cancer, right? And then finally, what is the final lymph node for the breast cancer? So if I ask you in breast cancer, guys, remember the mnemonics for the breast cancer staging we have discussed in the short course in Medsynapse app. Breast cancer mein supraclavicular lymph node is involved. It is what end stage? What nodal stage is it? It is the final stage, right? That is the final stage. So that is 3C. Okay, that is 3C. I hope you remember that, right? So remember, it is the final stage supraclavicular lymph node. So right hemithorax, left hemithorax, supraclavicular lymph node is going to be involved. Okay. Going to next, mediastinal lymph nodes and the hilar lymph nodes. So trachea, esophagus and esophagus are in the mediastinum. So mediastinal lymph node. Lungs wala hilar lymph node. Important point that has been asked in recent FMGE exam also. Whenever you see bilateral hilar lymph nodes, what do you think of? You think of sarcoidosis. This is one of the recent FMGE exam question. Very, very important. Bilateral hilar lymph nodes is seen in sarcoidosis. Okay, and in TB it is generally asymmetrical unilateral hilar lymph node. Okay, going to next one, axillary lymph nodes. Which cancer do you think of? Breast cancer, very, very important. Plus the upper limb also will drain into the axilla, right? Anywhere in microbiology have you read of any infection, you know, where there is this upper limb mein ya swelling hai, cellulitis hai, and there is axillary lymph node? What is that condition? Yes, very good. Anonymous 007 SRR, potato nodes, Garland sign. On gallium scan, you get the lambda sign. In sarcoidosis, all of that. Tell me, what upper limb condition have you read about? Okay, very good. One is sporotrichosis. What else? What else? Another one you might have also read about, the cat scratch disease. And the cat cat scratch वाला disease, okay, where cat scratch, फिर यहाँ पे swelling हो सकती है, axillary lymph nodes हो सकते हैं, right, all of that. So remember, even that will basically have your axillary lymph nodes. So this is to remember that the upper limb is draining into axillary lymph nodes, breast you always know is draining into axillary lymph nodes, and the skin above the umbilicus, this is also going to drain into the axillary lymph nodes, skin above the umbilicus also. So remember, breast cancer metastasis comes here, okay, right. Very, very important. This is a very important and a potential question. Whenever there is epitrochlear lymph node, right? You have the trochlea of the humerus. Epitrochlear lymph nodes, practicals में भी आपने final year में देखा होगा. Epitrochlear lymph nodes are very, very important for secondary syphilis. Okay, very important, secondary syphilis. Remember, epitrochlear lymph nodes. Okay, so secondary syphilis is epitrochlear lymph nodes. What lymph nodes do you have in rubella? What lymph nodes do you have in rubella? When we talk about rubella, what lymph nodes is very important? Posterior auricular, occipital lymph nodes. So remember, those lymph nodes are important in rubella. Posterior auricular, occipital lymph nodes. Epitrochlear lymph node is secondary syphilis, very, very important. Okay, very, very important. Yes. So that was about the lymph nodes above the diaphragm. Okay, we have spoken about above the diaphragm wale lymph nodes, submental, submandibular, deep cervical, mediastinal, hilar, axillary, supraclavicular, right, epitrochlear lymph nodes. That is what we have spoken about. Is this clear with everyone? Yes, very good, Ramesha. That's posterior auricular. Okay. Now we are going to the lymph nodes below the diaphragm, right? So below the diaphragm, that means we are coming into the abdomen. So tell me, abdominal aorta ke branches supplying the GIT starting from the stomach, then you have duodenum, jejunum, ileum, right? Then the colon starts. So what are the arteries supplying this GIT from above down? Tell me the three arteries which are coming here. The anterior branches from the abdominal aorta. What is the first one? What is the first one that you have here? The celiac artery, then the superior mesenteric artery, and then the inferior mesenteric artery, right? So remember, celiac, superior mesenteric, and inferior mesenteric. And that is how the organs are also going to drain into it, right? So you will have the stomach, duodenum, upper part, basically, which is going to go into the celiac one. Superior mesenteric artery supplies till what point in the GIT? Superior mesenteric. It supplies the jejunum, the ileum, even the colon. Colon till what part does it supply? Remember, till here you have the superior mesenteric artery, the right 2/3 of the colon. So the right colic artery, the middle colic artery is coming from the SMA. From the IMA, the inferior mesenteric artery, it supplies the area beyond that. Right, you have the left colic artery coming from the IMA. This is also a question that has been asked in one of the recent exams. Right, so the right and middle is from SMA, the left is from the IMA. So similarly, you will have this celiac, superior mesenteric, inferior mesenteric lymph nodes. Celiac is the upper organs just below the diaphragm, so liver, stomach, spleen, pancreas, and the upper duodenum. Superior mesenteric, lower duodenum, jejunum, ileum, colon till the splenic flexure, right? So the right and the middle part. Then you have inferior mesenteric till the upper rectum, right? So till the upper rectum, you have the inferior mesenteric. Is this clear with everyone? Right? So you don't have to mug up the lymphatic drainage. Understand the arterial supply. Automatically, you would understand that where the lymph nodes are draining, right? So upper wale organs, the liver, stomach, spleen, pancreas, upper duodenum, it is celiac. Lower duodenum up to the splenic flexure is superior mesenteric artery. Then you have inferior mesenteric wala, which is going to be the left side of the colon and the upper rectum. Okay, and the upper rectum. Is this clear with everyone? Yes. Coming to next one, this is also a very frequently asked question. When you see this peri-umbilical, what is that called as? Sister Mary Joseph node. So where is the Sister Mary nodule? This is peri-umbilical lymph node, which is commonly seen with gastric cancer. Okay, which is commonly seen with gastric cancer. Remember, umbilicus is gastric cancer. Okay, that is gastric cancer. Now coming to the next one, the aorta, and the iliac branches. So you have para-aortic lymph nodes, external iliac and internal iliac lymph nodes. Okay? So you have the aorta, which divides into the common iliac, which divides into internal iliac and external iliac. So we are going to talk about these para-aortic lymph nodes, external iliac lymph nodes and internal iliac lymph nodes. Okay? So now tell me that aorta is supplying which paired organs? Directly the branches are coming from the aorta. Remember, the gonadal arteries are coming directly from the aorta. So testes and ovaries, they will drain into the para-aortic lymph nodes. Renal artery comes from the aorta directly, right? So remember, two jo double wale organs hai, two kidneys, two testes, two ovary, they are going into the pair wale lymph nodes, para-aortic lymph nodes draining the paired structures, testes, ovary and kidneys. Okay, very, very important. So this is very frequently asked question. Testicular cancer hai, to kahan pe metastasis hoga? Para-aortic lymph nodes. Okay, very, very frequently asked question. Testicular cancer is going to drain into para-aortic lymph nodes. Remember, testes are paired structures, so para-aortic lymph nodes. Okay. Then you also have the pair of fallopian tubes and even the fundus of the uterus. Then you have external iliac and internal iliac, right? So now we are going to these pelvic vale structures, the bladder, the uterus, cervix, vagina and the rectum. Okay. So external iliac and internal iliac. So what is draining this? So to understand this image of the pelvic organs to get this visual memory. So imagine like these are the external ones. So if you are coming from the bahar se, external. First is bladder, then is uterus and then sabse andar is the rectum, right? So remember that this rectum is basically the innermost one, right? So it is the innermost organ when you are coming from outside. So that is going to drain into the internal iliac lymph nodes, not the external iliac lymph nodes. Okay, that's going to be internal iliac. The external iliac is the upper part of the organ. So the superior bladder, the uterus and the upper part of the cervix. This is going to be external iliac lymph nodes. Okay? So look at this one. External iliac lymph node is body of the uterus, cervix and superior bladder. You do not have rectum here. Rectum is innermost. It will go into the internal iliac. Okay? Now the lower part which is there, the inferior bladder, the remaining part of cervix, the proximal vagina, bladder ke niche you have prostate, all of this and the lower rectum to anal canal above the pectinate line. These are going to go into the internal iliac. So again, if you come to this image, so this one including the prostate here, including the cervix and the upper vagina, including the rectum, anal canal up to the pectinate line, all of this are going to go into the internal iliac lymph nodes. Okay. So remember, external iliac is bahar ke do organs, the bladder and the uterus. Even in that, the upper part, the superior bladder, the uterus and the cervix ka part. Okay. Lower part, that is inferior bladder, uske bajo mein prostate, then the rest part of cervix, upper vagina, rectum till the anal canal pectinate line, that is going to go into internal iliac lymph nodes. Okay. Clear with everyone? And then you have finally coming is superficial inguinal lymph nodes. So you have the inguinal ligament, uske paas you have the superficial inguinal lymph nodes. Remember, superficial inguinal is draining the superficial organs which are close to the skin, right? The external part, close to the skin. So you have distal vagina, close, the outermost opening. You have vulva, this is very, very important. For CA vulva, the first lymph node is the superficial inguinal lymph node because it's the outermost part, skin jaisa. Scrotum is the external organ, so superficial inguinal. Urethra, anal canal below the pectineal line, right? So again, if you look at this image, everything which is coming down, right? ये जो skin के पास आ रहा है, urethra, the lower vagina, the anal canal, इसके आसपास यहाँ पे vulva. All of this is going to drain into the superficial inguinal lymph nodes. Okay, superficial inguinal lymph nodes. Skin above the umbilicus. Skin above the umbilicus. We said what lymph node is the skin above the umbilicus? Skin above the umbilicus was this axillary lymph node, right? And skin below the umbilicus is going to be this superficial inguinal lymph node. Remember, skin is superficial, so superficial inguinal lymph node. There's an exception, we'll talk about that. That's the popliteal area, does not drain into the superficial inguinal lymph node. So where does the popliteal area drain? Remember, popliteal is like poplateral. Okay, so popliteal, the posterior calf and the dorsolateral foot, that is draining into the popliteal lymph nodes. So very, very important. Remember here, medial foot and lateral foot. Okay, or the medial leg and the lateral leg and the posterior leg. So medial is going to be superficial inguinal. So imagine you are tracing this medial leg. Okay, so on yourself, try to trace this medial aspect of the foot and the medial leg. Where is it ending? Into that groin region. Okay, the groin region, that is the inguinal one. So medial is going to be superficial inguinal. You can also remember it as SIM. Superficial inguinal is going to be medial part. Medial foot, medial leg cellulitis. Lateral is going to be poplateral. Okay, so popliteal is the lateral foot and the posterior calf. Okay, lateral foot and the posterior calf. Is this clear with everyone? Right? One very important point to be added here. Okay, very important point to be added here. Where does glans penis drain? We have spoken about all those pelvic perineal structures, but remember for glans penis. Glans penis specifically, remember, it is deep inguinal lymph node. It is not the superficial inguinal lymph node. This is very frequently asked question. Glans penis is deep inguinal and not superficial inguinal lymph node. Is this clear with everyone? Yes, Ketan. Remember, popliteal artery is difficult to palpate. This is something that we read in the popliteal fossa structures, which is the deeper most structure, superficial to deep. So popliteal artery is the deepest. Okay, popliteal artery is the deepest. सबसे ऊपर आती है आपकी tibial nerve, फिर popliteal vein और फिर आता है आपका popliteal artery. वहां देखा था हमने. Deep inguinal lymph node में lymph node आता है lymph node of Cloquet. Okay, that is the named lymph node there. Okay, clear with everyone? So look at this image again to get a visual memory for the anal canal, right? Rectum anal canal ka drainage. This is the pectinate line. Whatever is below the pectinate line, right? You remember that it is like the skin which has the pain sensation. जैसे यहाँ पे external hemorrhoids होते हैं, तो ये skin वाला external वाला part है. Where does this drain? Superficial inguinal lymph nodes. Above that, it is internal iliac lymph nodes, right? The rectum, which drains first into pararectal lymph nodes, and then they are draining into the internal iliac lymph nodes, right? So rectum above the anal canal, that is internal iliac lymph nodes. Below the pectinate line, superficial one, it is superficial inguinal lymph nodes. Okay, superficial inguinal lymph nodes. So let us quickly revise whatever we have learnt here. So a few important points which are frequently asked in the exam. Okay, first one, tell me the lymphatic drainage for CA vulva. What will be the lymph node for CA vulva? A quick revision of the important points. What is going to be for CA vulva? Imagine vulva, outermost, skin wala. That is going to be superficial inguinal lymph nodes. Okay, superficial inguinal lymph nodes. Tell me for CA cervix. Where does cervix drain? सर्विक्स हमने कहाँ देखा था? सुपीरियर ब्लैडर, यूट्रस एंड सर्विक्स. फिर बाद में नीचे भी देखा था इंफीरियर ब्लैडर, सर्विक्स. सो रिमेंबर फॉर सर्विक्स, सी सर्विक्स के लिए इट इज EIO, एक्सटर्नल ईलियक, इंटरनल ईलियक, प्लस ऑल्सो रिमेंबर द obturator lymph nodes. External iliac, internal iliac and obturator lymph nodes. Okay, and obturator lymph nodes. Next one important, if it is for the foot or the leg, medial and lateral. Okay, medial or dorsolateral. Medial is going to be superficial inguinal. Lateral, dorsolateral is going to be poplateral. So that is going to be popliteal. Okay, dorsolateral, or be it the posterior calf as well, it is the popliteal one. Okay, coming to umbilicus, skin above umbilicus and skin below umbilicus. Above umbilicus, remember this is also above umbilicus, like upper limb jahan ja raha hai, that is axillary lymph node. Below umbilicus it is superficial inguinal lymph node. We are talking about skin, right? Skin is superficial. So superficial inguinal lymph node except the popliteal area. Popliteal wala is your popliteal lymph nodes, the dorsolateral foot and the posterior calf. Okay, very, very important. Is this clear with everyone? Right? Which supraclavicular lymph node is involved in the gastric malignancy, abdominal malignancy? Right supraclavicular or left supraclavicular lymph node? Remember, it is left supraclavicular lymph node, which is called as Furchow lymph node, which is involved in the abdominal malignancy. Sister Mary Joseph nodule, periumbilical lymph node, again is gastric cancer. Okay, remember, again that is gastric cancer. Glans penis is deep inguinal lymph node. Okay, glans penis is deep inguinal lymph node. Then you have the next one for testis. Where do the testes drain? Testicular cancer, pair of testes. Remember, it is para-aortic lymph node. Pair of testes is para-aortic lymph node. Glans penis is deep inguinal lymph node or the lymph node of Cloquet. Okay, deep inguinal lymph node or the lymph node of Cloquet. Very, very important. Okay, clear with everyone? And the last point that we said in the beginning, we'll discuss about that, lymphatic drainage of the tongue. There has been a question in the recent exam, particularly when they show you, suppose they show you an image and they tell you that this is where there is the malignancy on the lateral border of the tongue, the anterior 2/3 of the tongue lateral border. What does it drain into? Which lymph node will it drain into? Yes? Anterior border of anterior 2/3 tongue में lateral border पे है. Which lymph node will it drain into? Unilateral submental lymph node, unilateral submandibular lymph node, bilateral submandibular lymph node, jugulo-digastric lymph node, jugulo-omohyoid lymph node. Where does it drain into? The question is for the lateral border. Yes? Very good, right? Remember this point that it is only the tip here. Yeah. So the lateral border is the one which goes into the unilateral, the ipsilateral submandibular lymph node, right? What part of the tongue is draining into the jugulo-digastric or the jugulo-omohyoid lymph nodes? We have discussed in your short again tongue वाले में कि ये जो T shape का part है, okay, this is the T shape, T for tongue, okay. So the posterior part of the tongue, the middle part of this anterior tongue, except the tip here, this is what drains into bilateral jugulo-digastric and jugulo-omohyoid. Jugulo-digastric muscle is here, jugulo-omohyoid muscle here. Okay, and the tip of the tongue which is present here, the tip of the tongue, this is what goes into bilateral submental lymph nodes. Remember at the tip, this is the tip के नीचे आ रहा है chin. So this is going to be submental lymph node. Tip wala is submental, ये वाला is ipsilateral submandibular. Rest T part is bilateral jugulo-digastric and jugulo-omohyoid lymph nodes. Okay, jugulo-digastric, jugulo-omohyoid, the rest part is going to be that. Is this clear with everyone? Yes, so it's not just the posterior part but also this middle part here. Okay, the middle part in the anterior 2/3 of the tongue, the center of this one, this also drains into the bilateral jugulo-digastric and jugulo-omohyoid. The tip is the bilateral submental. Only this lateral border which is on one side, that is going to one side submandibular lymph node. Remember यहाँ पे side में आ रहा है submandibular, so it goes into submandibular lymph node. Is this clear with everyone? Yes. So that is about your lymphatic drainage. I hope it is clear with everyone and it is not any more confusing. If you just remember the arterial supply, then you know the lymphatics also, like the right part of the colon, right? Ascending, transverse, splenic flexure tak is going to be superior mesenteric. Uske niche it is going to be inferior mesenteric, then comes the rectum, the internal iliac lymph nodes, and then comes the final anal canal, the lower part, which goes into the superficial inguinal lymph node, right, the lower part. So the vulva, the anal canal, right, the lower vagina, that is what is going to be going to go into the superficial inguinal lymph nodes. Okay, done with this, guys, right? So a topic which seems very complicated, but actually it is very easy. Prachi, class on antibody structure. What exactly in antibody structure? Right, so I'll upload the annotated PDF in the Telegram group and also on the Medsynapse app in the fast folder that you have in the content in short. Again, a reminder for anybody who joined late, please do not miss on this opportunity to give this free mini GT in the Medsynapse app by Dr. Nikita, which you will find in the short course content में टेस्ट डिस्कशन में मिनी जीटी डिस्कशन वाला जो फोल्डर होगा उसमें there's mini GT 5. First attempt the test attached to the video. Then you can download the PDF, blank, annotated both, and as you watch the video discussion, available to all the questions, 40 questions are there. You can make your own notes or you can just highlight in the annotated PDF as well. You can get the PDF, export the PDF to your device and you can make notes on that. Okay, so please give that test. It's free only for a limited period of time. Right, so if there is any other query or you are not able to reach to that test or give that test, please reach out on our support number. You can WhatsApp on 9922 882189. Okay, so you can WhatsApp on this number if you're facing any query related to the app. Okay, mini GT is going to be free till tomorrow, that is 11th of March. Right, so you can give it till tomorrow, 11th of March midnight. Nirzai, it's not just you. I'm receiving so many messages from the students that, the recent GT that they have given on the primary platforms, many students have faced this drop in the GT scores. So I believe that that must have been definitely a difficult GT or a tricky GT, and that's why the scene there. So remember, you are not alone there. Everybody is sailing in the same boat, right? So do not get disheartened by the GT score. You are not giving GTs just to see the scores, but to learn your weak areas, where we are still making mistakes. So you have a lot of time to improve on it. So be grateful, be thankful that I would learn now that where am I making mistakes. Try to analyze, whether it was the lacuna in the content that I have learned, or was it I knew the answer but somehow I did not mark the right answer. So that is what will help you analyze the GT and then work on the areas that comes as the analysis. This is where we are lacking, right? Is it basically the content, or is it the revision, or is it the MCQ skills, is it silly mistakes? Analyze that and accordingly work on that, right? If it was like you knew the answer but still you marked the wrong answer, that it just means that you need more revisions and you need more MCQ practice. Okay? Because overall it has been a very difficult one, I believe. Yes, definitely, Rumisha. Right, if the percentile is good, that means you are still there, on a good scale as compared to others as well. How to deal with burnout? 7, right? The best way to deal with burnout is to take, frequent breaks, right? Don't just get into this, I want to study for 12 hours non-stop or something like this. Frequent breaks actually help you increase your productivity and not get the burnout, right? So the breaks, first of all, have to be timed breaks, and second, the breaks can be productive as well, in the sense they help you develop your other pillars that I talk about, like go on a quick walk, right? And or maybe some yoga, some meditation, something which is helping you develop your other questions as well, right? Or do whatever you love, any hobby that you have, be it music, be it dance, or whatever. Okay, talking to your loved ones, family, friends, take these breaks. These are actually much needed. Okay, Prachi, I'll definitely look into it. Page 102 and 103 of first aid that you were talking about. I'll definitely look into it and we'll try to have a session very soon on that. Nikila, it's not important to study for long hours. Remember, it's never the quantity, it's the quality which is very, very important, right? If you're able to give that output, your daily target in a lesser amount of time, that's pretty good. But if it's not, right, and you're not able to stretch yourself to study for long hours, all you need for that is your inner drive, the burning desire to achieve what you are doing. If you're doing this out of that burning desire, because this is what I want, I'm not doing it for somebody else or to satisfy or please other people surrounding me, then you will have that inner drive if you understand the importance of why am I doing this. So if your why is very clear, okay, why is it important for me to put in those extra hours, to go that extra mile? If you understand the why of it, the how becomes very easy. So how you do it becomes very easy once your why is clear. So I think first let's work on the why, right? Yes, Prachi, point noted. I hope this is clear with everyone. And so Nizar, remember that not all days are same and not all GTs are the same. Sometimes you would score good, sometimes you might not score good. It's absolutely fine, right? Just work on your weaknesses and turn them into strengths. There's no point into crying over the low scores and all. Just see that how can I improve it. That's all, right? Learn out of it and move on. That's the best thing that you can do. Yes, these are present there in the Medsynapse app. Okay, right. So that was for today, guys. Thank you so much, and I'll see you soon on the Medsynapse app for pharmacology KBMD that's coming up. Right, and on 12th we will have pathology KBMD for the RUHSMO students. Then we will have pharmacology KBMD for everybody. So please be prepared for that. And thank you so much for joining in. I hope this was a useful session. Like I said, please make one-page notes out of this session so that you can revise it at the end, and do not forget to give the mini GT5. Okay. Thank you so much. Goodbye. Take care and keep studying, keep revising, keep med synapsing and keep winning. Thank you.